My name is Dr. Tushar Mehta. I'm from Canada, and I did my residency there in family medicine. I've also practiced addictions medicine, and I've mostly practiced emergency medicine, or what you call A&E in some countries. I have an interest in international health, and I do work in India and a few other places. And on top of that, I have a strong interest in plant-based diet and health. So when I say plant-based diet and health, you can also say vegan diet and health. And I'm here on behalf of Hina Modi and plantshift.com. The next study I'm going to talk about comes from England, and it's about cardiovascular disease. It's the risk of hospitalization or death from ischemic heart disease amongst British vegetarians and non-vegetarians. Results from the EPIC Oxford cohort study. So this was published in 2013 in the American Journal of Clinical Nutrition, and 44,000 subjects from England and Scotland, followed for just almost 12 years, just 11 and a half years or so. And there was about over 1,000 admissions for heart disease, 66 deaths, and 1,200 total cases. The vegetarian groups had a 32% lower risk of heart disease. So quite significant again. Again, this group in this study, for whatever reason, maybe they haven't followed them for long enough, but they didn't separate the vegans from the vegetarians in this group. Okay, they had sort of, I guess, fish eaters, meat eaters on one side, vegans, vegetarians on the other side. So that's maybe one of the weaknesses of the study. I think what they're going to probably do is follow these people for a longer time and see if there's more separation between the subgroups. All right, so we all know about a good case study, and that is Bill Clinton. Bill Clinton followed Dean Ornish's advice. He had severe heart disease, and he was told that he didn't have long time to live, but he saw some of the studies, he looked at this stuff, he saw what Dean Ornish and other people did. He himself went on a whole food, low-fat, plant-based diet and lost a lot of weight. Not only that, though, but his heart disease did improve, stabilize significantly. So there's an interesting case study of somebody who saved their life that way. All right. Note that when you have blood vessel disease in your coronary arteries, that's the arteries of the heart, you're going to have blood vessel disease in the arteries going to your brain, to your intestines, to your bones, to your back, to other organs. And people, there's not a good study on this, but there's a lot of people who've gone on this kind of a diet, and what they suffer from is erectile dysfunction because there's blood vessel blockages. Obviously, you need the plumbing to work. And what happens here is that as they're reversing some of their heart disease, other things start working again. So interesting tidbits, and that's what we're going to talk about when we're talking about stroke and other blood vessel disease in one of the upcoming videos. Study in 2012, published in 2012 in the Annals of Metabolism and Nutrition. Okay, it's called Cardiovascular Disease Mortality and Cancer Incidence in Vegetarians, a Meta-Analysis and Systemic Review. All right. So what they did was they did a meta-analysis. That means they take the results from different kinds of studies that are very similar to each other, and they pool the results together to sort of get a bigger pool of study subjects, people, and get better, statistics on them, more solid stats. Okay, because the smaller the group of people or shorter time, it's harder to get proper stats on that. You need to get averages over a larger number of people. Okay, so 7 studies were combined, and it was 124,000 subjects in total from the UK, Japan, California, United States, Germany, and the Netherlands. All right. And in that group of people, let's bridge a little bit. The last video was about heart disease. They had 29% lower heart disease death, 29% less death from heart disease in the vegetarian group. So that's good. Here we have another study that's reaffirming results from different populations, and you're getting the same results. So that makes your findings more significant. If you get one study showing one thing, another studying another thing, you have to look at the studies and what's going on there. What are these populations? How old are they? What are their characteristics and whatnot? But so sometimes it's possible to get different results because you actually, when you look at the populations, you find key differences. And so, but in this case, anyways, the populations were and the studies were pretty similar, and they showed less cardiac mortality. Now, the interesting thing also here was there was 18% less cancer mortality in the vegetarian group than the non-vegetarian group. Okay, so what are the strengths of the studies? The strength of the study was that people were followed for a long time. Actually, if you look at the timings, there was a large group of people to get good statistical significance with. That's good. Many different countries involved. That's good. We see different populations and getting similar results. Okay. Let's come back to the Adventist study that I had mentioned before. So this particular study is called Vegetarian Diets and Incidence of Cancer in a Low-Risk Population, The journal is Cancer Epidemiology, Biomarkers and Prevention, published 2013, looking at the Adventist 2 group of subjects. So it's in this second Adventist trial, which, as I mentioned, it's still going on. They're still watching people for a longer time. 69,000 subjects followed, and they looked at vegans, vegetarians, semi-vegetarians, and pesco, like fish eaters, as well as standard diet. And they only followed them for 4 years so far, and the average age was 59. So an older group of people followed for 4 years, so it's early to really get results. And what they found was there was, in that time, because there's so many people, they did find there was almost 3,000 cancers, and the vegan group had overall cancer of 16% less than the other groups. But for certain types of cancers, female-specific cancers and cancers of the GI tract, the digestive tract, they had even more benefit than the total cancer, or the total number of cancers. So there's more benefits there. Okay. So the references for every single video that I have are going to be downloadable from the description box, where you can click and download the entire set of references, and then just scroll down to the relevant references. If it's a video on diabetes or cancer or something like that, scroll down to the relevant section and take a look at the references that I'm speaking about. In my videos, I'll generally discuss one reference, but it's going to take too long to discuss 10 references and you'll be bored out of your mind. So I'll discuss one, and then you can go into the reference list and look at more references that are talking about the same topic. And it's important not just to have one reference, but to have multiple references that discuss a topic, because then you're seeing that different studies are being done in different places by different people, and they're getting similar results that are reinforcing each other. Okay, so that's another good thing to look at.